Good afternoon, everybody. I am Liliana Coronado. I help Addiction Policy Forum with government affairs and advocacy work, and welcome to our advocacy session. I would have the pleasure of introducing a couple of individuals who have been very instrumental in helping us with our advocacy work. As many of you already know, Addiction Policy Forum brings together patients. It's a network of patients, families, practitioners, and individuals to advocate for policies that support individuals impacted by substance use disorder. We've worked, as you know, on the Comprehensive Addiction and Recovery Act and numerous other pieces of legislation, and we've had the help of many individuals and patients and families. We have two of them here with us today to share their experience and their work with us on advocacy efforts on Capitol Hill. First, we have Lorraine McNeil Popper, who is the co-chair of APF's National Advocacy Council. And we also have Michelle Jaskolski, sorry, Michelle, who is the other co-chair of our National Advisory Council. And we're going to take a couple of minutes to have each of them share their experience with advocacy on Capitol Hill. I'm going to turn it over and start with Lorraine. Lorraine, would you mind kicking us off?
Sure. Thank you so much for having me here. And I'm really excited to share my experience. My name is Lorraine McNeil Popper. When I was 29 years old, I lost my twin brother to an accidental overdose. My family and I were incredibly silent about his struggles, his death, and the experiences we went through. We never talked about it. So it's ironic that I'm an advocate and that I'm no longer silent. And that every chance I get, I speak up, I share his story and my family's story. Advocacy wasn't a title that was given to me. It was something I just did. Advocacy is one of the most powerful actions that you can take for yourself and for your loved ones. It humanizes the disease and puts a name, face, and life around those who have passed away and those in recovery. Addiction Policy Forum has given me the opportunity to be an advocate, to speak in person with some of the most influential people in this country and really make a difference. I've been to Washington, D.C. on so many occasions. I've met with senators, congressmen. I shared my story. And I will tell you, these congressmen and these senators, they really do care. As an advocate, you can really make a difference. For example, when one of the most important pieces of legislation around substance use disorder needed to be passed, it was called CARA, the Comprehensive Addiction and Recovery Act. Advocacy played a major role in the passing of CARA. Families from all around the country, we all came together, family members like myself, we met with stakeholders, members of the Senate and Congress, and we shared our story, and it passed. And it passed with flying colors. It is helping and has helped so many families in this country who have loved ones in recovery or who have passed away. In recognition of that, my advocacy work with CARA, I received an invitation to the signing of that bill with other family members who are here today. The signing of that bill into law, and I was personally thanked by the Speaker of the House. So there's so many roles that you can play as an advocate, you know, and the role of advocacy. Like me, I found my voice, I found mine, and as an advocate, you'll find your role as well. Thank you.
Thank you, Lorraine. Thank you for sharing that. And I'm going to turn it over to Michelle. You could share a little bit about your experience as well.
Of course. Again, thank you for having us. Like Lorraine said, we both have had the opportunity to talk to so many people in Washington, D.C., thanks to Addiction Policy Forum. And as Lorraine also mentioned, they really do want to hear our stories and appreciate our sharing. So my name is Michelle. I'm a mom of two sons who are in recovery from heroin use disorder. They struggled for about 6 years. Similar to other, like Lorraine even said, in the beginning, we didn't share our story. We didn't speak about it. It was a lot of shame and guilt surrounding that. But I found that once I was able to share my story and ironically, the first time I shared my story was in Washington, D.C. in the office of the Speaker of the House. So a little bit daunting, but I did it. And after that, it just became easier. And the more I shared, the more people felt comfortable opening up to me about their own stories. And so just besides advocating for laws, you can bring so much support and comfort to other families just by sharing your story. And it doesn't have to be in DC. Not everyone has that opportunity. I'm very passionate about advocating right here in my home state of Wisconsin. I make it a point to know my legislators, to know who's working on different bills that are in regards to addiction, whether it's criminal justice or MAT or treatment, anything like that. I get to know the lawmakers who are working on that, and I let them know me. I either call them or email them. Pre-COVID, I would make a visit to their offices in our capital. But just to, like Lorraine had said as well, to put a face to the story is really impactful and really important. So I just encourage everyone, again, share your story, get to know your legislators, get to know the issues that are out there surrounding addiction, and just do your part, whatever you can, to influence lawmakers and to let them know that this really is personal and this does make a difference in people's and families' lives. So again, thank you for letting me share.
Thank you both so much because it really is your experiences that I think are incredibly meaningful in this work of changing policy and making an impact on lawmakers and legislators. So I really want to move on to talk a little bit about just a primer on advocacy, but I hope Lorraine and Michelle that you can stick with us and stay with us to be able to jump in and provide your own personal experiences. There will be an opportunity for Q&A, but I think just having you available to continue to share with our audience about what has made a difference in your advocacy work, I think would be probably the most helpful. I also am going to introduce Eric Arndt, who is with Addiction Policy Forum and has been incredibly helpful on putting together this conference and also supports our advocacy work. Eric and I are going to do a quick primer on Advocacy 101 for folks who are listening. And then, like I said, we'll have a Q&A, and we will also be joined a little bit later by Congressman Trone to talk about two of his bills that are priorities for Addiction Policy Forum, and also Senator Booker's staff, who are going to be talking with us and giving us a legislative update on the Equal Act, which you've already heard about. So just to jump right in, I'm going to talk briefly, and then I'll turn it over to Eric about how to influence state and federal policy, but primarily federal policy, and how to sort of jump into legislative advocacy, because it can be a little bit intimidating or daunting if you haven't done it before. It's actually quite straightforward and simple and involves really just building relationships. Next slide, please. We'll talk about the process. We'll talk about some of the terminology, authorizations versus appropriations, and how the terminology can sometimes sound more complicated than it is. And then we'll talk about when you are in a meeting. And now, because of COVID, many of these meetings are conducted the way we're having this conference virtually. But it seems as if it appears that we're heading back to potentially some in-person meetings on the Hill. So hopefully this advice will be helpful for both Zoom meetings and also in-person meetings and conferences that you're able to meet with legislators. Next slide, please. So we'll talk about how to brief them in your meetings. So this is a little bit like harkening back to PBS, how a bill becomes, well, I'm just a bill. But these are the steps that theoretically a piece of legislation or a bill goes through. They don't always make each of these stops, but in theory, this is how it works. Legislator introduces a bill. Depending on the subject matter of the bill, it gets assigned to a committee. The committee can have a hearing. Many of the bills that we work on or that you may want to advocate about go to Energy and Commerce Committee or to the Judiciary Committee, but it will be assigned to a specific committee that is tasked with taking it up and considering it. They can have a hearing, and they can have a markup where they take a close look at the bill and decide if they want to make any changes or to have members give input about the bill. They can also have another committee markup or consideration by the full committee. It could be a subcommittee or a full committee. Sometimes they skip the subcommittee and go right to the full committee. And then ideally, if all works well, and of course the process is never this simple, I know Lorraine and Michelle can tell you that, it goes to the floor for consideration by the full House or Senate. And if it gets passed, if there are amendments that can happen on the floor or in committee, it goes to the other chamber and starts the same process all over again with some minor differences. If the other chamber has a different bill that they've introduced, they have to conference those and get together to iron out the changes and make one consistent bill, or the other chamber can take up the same bill that the first chamber considered. There is sometimes a committee report or a conference report, and then finally, when it passes both chambers, it goes to the White House to sign it, ideally. And then if there's a veto, there needs to be 2/3 of a vote of Congress for an override. That is just the process from start to finish. There are many other little steps in between there, but overall, that's the process that how a bill kind of moves through the Congress and becomes law. Next slide, please. There are two real categories, or two real buckets, if you will, of types of bills: authorizations and appropriations. And it can sound confusing, and an authorization is not necessarily an intuitive way of talking about policy, but authorizations create the actual policy that gets enacted into law. So it creates a policy for a particular program, it creates policy for an agency potentially, and some of the bills that we have, that Eric will talk about and that we're prioritizing as part of APS legislative agenda, are authorization bills, and that they will affect a particular agency or change or enact a particular policy. Appropriations bills provide the funding for those agencies and programs, provides the actual dollars to those. And so the appropriations process is equally as important, if not more important, because you need funding to do much of the good work that we want to see get done. Next slide, please. There's a kind of a simple explanation or somewhat simple analogy around the buckets, the two different types of buckets. When you create a policy, you authorize through an authorization, you create a bucket for a certain policy project or program. It can be seen as a bucket. It creates different, authorization. We authorize a SUG program or a opioid prevention program at, let's say, $1 million or $500 million for this program. And Congress decides that that is what they want to do, and it becomes law. It's a bucket, but it's an empty bucket. So you've given the authorization to have a program around that issue, but the bucket is empty until it's appropriated. So then you have to go to appropriators in different committees to fill these buckets up, to say, okay, we see the authorization for $1 million opioid prevention program. It has not been funded, but we will fund it at that level. And there's a second process that goes through to be able to figure out how to fill up those buckets. So it's a two-step process. You can work on a bill or a policy and get it authorized, and then your work is not over. You then work on trying to make sure that it gets funded so it can actually be implemented. Next slide, please. There is sometimes confusion about the budget process versus the appropriations process, and the way to sort of think about the difference there is that the budget is a framework for funding the government, and the appropriations process is actually issuing the funding and funding the programs within that framework, and also very detailed funding for programs within different agencies. Next slide, please. The budget process is informative, and we want to look at it as advocates because it tells us where the administration is, where their priorities are and where they are requesting funding from Congress. So every year the president will issue budget requests to the Congress about what their administration priorities are. And it's supposed to happen in February of every year, and that sort of kicks off the process. But it can sometimes come out late. This year we've had a very late process, and we're still in the middle of it. But that's the starting point. And everybody, when the president issues his budget and his priorities for every agency and every project that we work on, we jump in quickly to see, where is the thinking on different key programs. And then Congress, of course, considers that, takes a look at that as well, but doesn't have to fund the programs at the level that the president or the administration has requested. So they come up with their own budget framework and pass their own budget, and it differs with what the president has requested. Or it can differ. Next slide, please. The appropriations process, and if you listen to the news or if you're engaged in this process, is interesting because it has to happen every year. And the way we get to the appropriations and funding the government sometimes is not a linear path. Often it is not a linear path, but you will hear as we get close to the end of the fiscal year and close to October 1st, there is always a news and conversations about, is the government being funded in time? Are we going to have a shutdown? Are we going to avoid this? And Congress always has to figure out a plan before October 1st or the lights go out. And so there's a lot of buzz around the end of the fiscal year around that. Appropriations bills are supposed to be about funding, specifically and solely about funding. They're supposed to be about different funding levels and different program priorities. And you're not supposed to really, the strict letter of the law is that you're not supposed to put authorization or new programs or create new programs in there, also known as riders. But we all know that what I'm saying is the ideal way that things work in Congress, but is not always the way it is really implemented, if you will. Things go sometimes in a different direction or path. And so sometimes you do see riders or policies put into appropriations bills because they are also must-pass bills. And so sometimes a good strategy or one strategy for getting policy enacted is to attach it to an appropriations bill that must pass. Next slide, please. Shifting gears a little bit to when you actually go to meetings and some of what Lorraine and Michelle were talking about. When you are preparing to request a meeting or you have set up a meeting with your member of Congress or with the member of Congress that is important and a key lawmaker around a specific issue that you are working on, we have some recommendations around sort of how to prepare for that meeting. The first thing, and again, sort of just going back to the basics, know who you're meeting with. Get to know the legislator as best as you can through your own independent research. You can use Facebook or other social media to sort of look at their websites and figure out what are the things that this lawmaker cares about, what have they been working on, what are their legislative concerns, and personally, what is their background. Know the state that they come from, they're representing, and know the district if you can. And all of that is available either on their own website as a member of Congress, and also just doing good old Google searches and Facebook and whatnot. It's helpful to have materials and to prepare those in advance to sort of synthesize what it is that you're there to talk with them about. You want to be concise in those materials. Ideally, it's a one-pager. It's a summary of what you're there to talk about. And when you're preparing those materials, it's important to keep in mind that you want to make it as local as possible for that individual and that lawmaker. So if you can, tailor your materials to concerns and issues in their district to the extent that they overlap with what you're there to talk about. Sometimes folks get a little disappointed when they make member requests for meetings and they are unable to meet with the lawmaker, but the staff attends the meeting. But staff are sometimes more important than the lawmaker in the sense of the information that you're conveying to them. And as a former Hill staffer, I know Jess is as well, and I know Ron is as well, who spoke earlier, we can attest to, and Eric as well, we can attest to the fact that staff are the individuals really doing the day-to-day work and doing the deep dive into the issues and preparing all the materials for the member of Congress and briefing them. And so what they share as in terms of what's important is critical. And so I never mind having a meeting with staff because also I find that those meetings can be much more sort of in the weeds and detailed, because they just have more time and they need to get to know the issue well to be able to advise the member of Congress. If you are bringing other folks in from your organization or your community, that's great, especially if they have a lot to share or personal stories to share, but you want to just make sure that they are also prepared with the materials, that they understand the meeting, and that you all are there sort of on the same page. You just want to make sure that they're with you every step of the way. Next slide, please. So some of this we just talked about. Have your message ready. What is it that you're there to convey? Make sure that you can give your elevator speech, so to speak, around the issue, because again, time can be limited, and you also just can be much more persuasive if you have a very clear message. Have an ask, if you will, have a request. Why are you meeting with them? What is it that you'd like them to do for you or for the organization or for the community that you represent? Do you want them to co-sponsor a bill? Do you want them to introduce a bill? Do you want them to support a funding request for a particular policy? Whatever it is, just have that prepared and ready to make that ask. And I think for this group and this audience and this conference, I don't think I need to emphasize enough the importance of a personal story or a direct impact, that the reason that you're having the meeting. If you have a personal story, or if you are accompanied by someone that has a story that they're willing to share, that is much more impactful than any other sort of talking points or policy. Policy details, they tend to stick with both the staff and the member of Congress. We've talked about preparing your materials, and then we'll talk a little bit about the follow-up after a meeting. Next slide, please. I wanted to just pause on the power of stories and hopefully circle back with Lorraine and with Michelle about this as well. But if you don't have a personal story to share, but somebody has shared one that you can take with you in your advocacy efforts, it's just incredibly compelling. If you have individuals that have personal stories that come from the member of Congress's district or state, it's even more powerful. And if you can share those, or if you've been given permission to share those, or if you feel comfortable sharing those, they will go a long way. Sometimes, and this is sort of a little bit kind of stepping back a little bit and talking about other ways of advocacy besides direct meetings with members of Congress. Sometimes we can consider things like op-eds and sharing stories in that way, and also just advocacy sort of on the grassroots advocacy, like what Michelle and Lorraine have done, and also what APF really sort of marshals people to do. Next slide, please. During the meeting, ideally, if you have business cards, if you represent an organization, that is the currency in Washington. I don't know if it still isn't COVID times, but if people are still exchanging business cards as they do, but your contact information in some way, whether it's a business card or on your one pager that you're gonna leave them, your leave behind, you wanna have a way for them to reach you if they have questions when they go back and review the materials, or if they have more information that they'd like to receive from you. You wanna be clear, you wanna be concise, you have a key message, your ask, and you give them a one pager, ideally ready to go. And if it's more than one page, you give them those 2 pages in a little packet. If you have to go into page 2, and I know sometimes we do, just make sure it's in a very organized fashion for them. Again, right now that we're doing so much virtually, some folks still want paper, so they want a PDF of whatever it is you're going to be sharing so that they can print it in their office or in their home office. But we do want to make the materials accessible to them and easy for them to access later when they're going over and preparing and briefing the member of Congress. Next slide, please. Sometimes we think, and I'm a former litigator, so I like paper, and sometimes we think that paper is just the way to go. If I can just give them all the information on this topic, it's going to be helpful, a binder, folders, a Redwell. And that really is just actually the opposite of what staffers are looking for and what they need. And in order to really be a good resource to them, which is ideally when you leave these meetings, they will see you as a potential resource on this issue that you're talking to them about, you want to make their lives as easy as possible. And so synthesizing and summarizing and condensing the information into digestible materials is really incredibly helpful for staff who are usually managing, many different bills and projects and portfolios for the member of Congress. So we want 1 or 2 sheets and not a whole ton of sheets or binders. Next step. Next slide, sorry. And then after the meeting, just again, some of the real basics that sometimes we can all just need a reminder to do. You want to send them a nice, quick and brief email or thank you letter for taking the time to meet with you, whether you met with staff or with a member of Congress. Just following up. If you had a conversation where you said you would share additional information or were going to follow up and answer a question, if you didn't have everything that they needed at your fingertips or that they asked about, make sure that you get them that information as soon as possible in that email, just following up with the things that you promised. And ideally, you're building this relationship with the staffer or the member of Congress on this particular issue so that you can be a resource for them and be somebody that they can go to on an issue that you're talking to them about. Next slide, please. And that doesn't mean necessarily becoming their friend or socializing with them, but really being a reliable and trusted source of information on the policy that you're advocating about. Responding quickly to their requests, making them look good when it's appropriate. So if you shared information with them or gave them an idea and they took it and ran, thanking them for that and helping lift up the good work that they're doing in this space. And then also tailoring things, as I've already said, and I don't think I can say it too much, to their own district and their local issues. Next slide, please. Quick summary of the do's and don'ts. I think we've already covered all of this, but this is kind of a handy little cheat sheet slide of like the things we want to keep in mind right before we're going into a meeting. One of the things that we haven't talked about is following up with them and getting them information that maybe you don't have on hand. And it's okay if you're in a meeting with a member of Congress or a staffer to say, if they ask a particular question or a particular stat that you don't know, to just say, I don't have that information right now, but I can certainly get it to you and I'll circle back. And then doing so. And getting them that information. It's okay. You don't have to be in these meetings with all of the answers. There are things that you may be asked about that you may not know. And then just being concise, organized, and nice, which I know we all are, and bringing your materials, being prepared. It is a lot more intimidating than I think in actuality it is once you're in there. And I think Lorraine and Michelle can speak to that, especially having been in the speaker's office. Next slide, please. Before I turn it over to Eric, I just wanted to see if Michelle or Lorraine have anything to add to that before Eric goes into some of APF's priorities. Anything that resonated or that you'd like to sort of say more about?
Yeah, I would love to just elaborate that. Yeah, sometimes you might feel disappointed that you were scheduled to see a specific senator or member of Congress, but they might be on the floor getting ready to vote. I found that a staffer is incredibly effective because, again, the day-to-day person, and they're constantly reminding their the senator or the congressman that this is an important piece of legislation, or this is an important issue. And so never feel disappointed. That message will get to them. And they remember you when you come back the following year.
Definitely. I was going to say that as well, Lorraine. I know a lot of people feel like disappointed, like Liliana said, but they definitely, staffers and aides can take more time with you and really allow you to share more than you might be able to with the actual representative. And I just wanted to reiterate what Liliana said to you about becoming a resource and building that relationship. That's what it's all about. And when something comes up about that issue, that office can look to you. I've had offices reach out to me and ask me, would I come to a press conference to share? Would I come in and testify at a committee hearing or something? So when you build that relationship with them, they really will look to you in the future to be a resource. And that's, like Liliana said, incredibly important to get your story amplified. And then if I could just share one other thing, Liliana, another way to get amplified that I've found is to engage your local media. I've made, connections with newspaper staff and news editors and things, and ask them to share about issues. And that kind of really helps to amplify your message around advocacy priorities as well. So that's something to consider.
Thank you both. Definitely really, really good advice. And again, you are all experts now, having done this and having been sort of thrown into it, and have done a wonderful job and really are the essential voice of APF. Turning it over now to Eric to talk a little bit about APF's legislative priorities.
Perfect. Thank you, Liliana. So yeah, as Liliana mentioned, my name is Eric Arndt. Recently joined Addiction Policy Forum a few months ago after a 6-year stint on Capitol Hill, working for both the House of Representatives and for the Senate. I'd just like to reiterate some of the points that Liliana, Lorraine, and Michelle discussed. The being prepared and having those one-page memos. I know I was always very grateful for the individuals I met that were super informative, were well prepared, especially when I was in the House of Representatives. House staff, they have to handle a wide range of issues. So they may have a meeting at 1:45 on agriculture issues, and then 2 o'clock on substance use disorder issues. So they're scrambling a lot, and so having those one-pagers or other critical information readily available is super helpful for the congressional staff. So yeah, to get into the advocacy priorities, we'll start off with the first slide. So starting off with one of our first bills, it's a very timely bill, the Medicaid Reentry Act. It would allow Medicaid coverage to individuals in prison and jail 30 days prior to their release. This would allow uninterrupted health coverage for individuals upon reentry into the community in order to decrease recidivism, allow savings for healthcare and criminal justice costs across the nation. As of right now, this piece of legislation is included in the Build Back Better Act, which is the reconciliation package you may have heard of that Congress is currently reviewing. As of right now, the House of Representatives were planning to have a vote on that today. They've been in limbo since this morning, so the future of that bill is still up in the air, but there are reports that there's positive feedback that bill will be advancing shortly. The second bill, which we've heard about a couple of times today, and we'll be hearing about again from Senator Cory Booker's staff, is the Equal Act. So introduced by Senator Cory Booker, it advanced through the House of Representatives in September, at the end of September, by a bipartisan vote. Essentially, you'll hear a lot more about this bill shortly. It will eliminate the sentencing disparity between crack and powder cocaine. The third bill, which I'm going to save mostly for Congressman Cho when he joins us, is the, I'm jumping ahead. Sorry, this bill is the Residential Substance Use Disorder Treatment Act. So introduced by sponsors Representative Sheila Jackson Lee and then Senator Cornyn on the Senate side. So this bill, it received unanimous consent, which is essentially an expedited process within the Senate, allowing it to pass without a recorded vote. It's essentially a voice vote. and is currently before the House of Representatives. This bill would reauthorize the Residential Substance Use Disorder Grant Program, which assists states with developing and implementing residential substance use disorder treatment programs within state correctional facilities, as well as local correctional detention facilities. And then we'll go on the next slide. And this is the bill that I jumped ahead to, the Family Support Services for Addiction Act, introduced in the House of Representatives by Congressman David Trone and Senator Kristen Gillibrand from New York in the Senate. So this bill, I'll let Congressman Trone elaborate on, but essentially it creates a grant program to help national and local nonprofit organizations provide critical support services and SUD treatment services. This bill passed out of the House of Representatives in mid-May under suspension of the rules, which is another version, the House's version of a voice vote, essentially, and is currently before the Senate for consideration. Another Congressman Trone bill is the State Opioid Response Grant Reauthorization Act. This would reauthorize this grant program for fiscal years 2022 until 2027. And this grant program helps states provide access to medication-assisted treatment and reduce opioid-related overdose deaths by providing prevention, treatment, and recovery resources. And additionally, this bill was passed out of the House in October, mid-October, and is currently before the Senate for further consideration. The third bill on the slide, the Preventing Overdoses and Saving Lives Act, introduced by Congressman French Hill. This bill, to summarize it, is a two-part bill. Would one, create a strategic plan to address the opioid crisis, and two, also allow co-prescribing, so allow doctors and other folks that prescribe medication to prescribe an opioid and an opioid overdose reversal drug together at the same time. And as right now, there's no movement on this bill specifically in either the House or the Senate. And then the final two bills I would like to touch upon as priority bills for Addiction Policy Forum. The first is another piece of legislation introduced by Congresswoman Sheila Jackson-Lee, the Real Justice for Our Veterans Act of 2021. So to summarize it quickly, it's another two-part bill to ensure veterans court treatment programs provide equal access for racial and ethnic minorities and women, and additionally ensure access to treatment and alternatives to incarceration for those who do not have a veterans treatment court in their location. And then the last bill that I would like to touch upon as a priority is the Stop Stigma Act, which we'll hear more about when Congressman Trone joins us within the hour. And this bill would amend the names of certain federal agencies to end the use of stigmatizing vocabulary, such as NIDA and SAMHSA, et cetera. And then have those federal agencies report back to Congress with proposed name changes to use moving forward. And so these are, just a handful of bills that we're closely tracking to see where they progress through Congress. And there's, I think as of right now, last time I checked, there was each bill is assigned a number. So HR1 all the way up until the most present bill introduced. I think there's roughly 4,500 bills introduced before the House. And so we're trying to make sure we stay on top of all the bills that are introduced and continuing the conversation with members of Congress in both the House and the Senate to advance our priorities. If you have any questions regarding these bills, or if there's any other bills that you see in the news, feel free to contact me. I know my email is everywhere in preparation for this event. I'll also drop it in the chat box as well if anybody on this call has questions. Thank you.
Thanks, Eric. And as Eric said, that's just several bills that we have identified as as priorities for APF and the subject matters that we were talking about throughout this conference and that we like to advocate on. But there are hundreds of other bills out there. So if there's anything that you'd like to flag for us or that you have been working on already in your own capacity, please share with us. Please share that information with us as well. We have decided to, as Jess said earlier, to try our hand at this virtual Hill Day in the past. And if you've been with APF for a long time, like Lorraine and Michelle have, you know that we would actually bring families and individuals to Capitol Hill to do in-person meetings and briefings and just take the Hill by storm, if you will. And this is a different approach, but we still want to bring your powerful voices to members of Congress. And so we have teed up some materials for folks to lend their voices to and lift up some of the bills that we have just talked about, and also that we are expecting Congressman Trone to speak about, and Senator Booker's staff, and the bill, the Equal Act that the Senator already spoke about earlier. We have put together 3 letters of support, one for each bill, one for the Equal Act, one for the Stop Stigma Act that Mr. Trone will talk about, and one for his Family Support Services for Addiction Act as well. And we have put together a template for letters of support, a sign-on letter that folks can append their name and organization to voice your endorsement and support of these bills. And the letter describes what each of them does in greater detail. And it is directed at congressional leadership to say, we support these, we endorse these, please consider these bills and pass them. We will also be sending information after the conference, letters on the other bills as well. But we have 3 of them ready for action during the session. And I'm going to ask when possible for Haley to, or Eric to put in the chat the links to those letters. We have tried to simplify it as best as we can by creating a Google form that will allow you to read the letter and plug in your name and organization, if appropriate, and your email to be able to append your name to the letter. And when we gather all the signatures, we will send that over on everyone's behalf to leadership, to the congressional leadership. We've also created some, and I see Eric just went ahead and put that, starting to put some of the information into the chat box for folks. We've also put together sample tweets so that you can engage on social media and do some advocacy that way as well. And sample tweets for each of the 3 that we're highlighting this afternoon to be able to share with your member of Congress and also with the sponsors of these important bills, your support for them. So we will put sample links to the sample tweets also, and you can modify and tailor those, of course, from your Twitter account and also to your member of Congress. So we're linking in these instructions how you can find the Twitter handle for your member of Congress as well. So if there are questions about that, please let us know, but we're trying very hard to streamline this advocacy effort and make it work for our virtual platform. I see that there is a question in the chat that we need to open permissions. And this is where our tech and learning curve shows, guys. We need to give permission for folks to view our equal letter. So in all of our letters, I think probably we might have that same problem. And so I would please ask Eric or Haley, whoever has access to that drive while I'm talking, to please give permission for folks to be able to get access to those. Okay. Let me look at, there is a question from in the chat around, are there any bills on the horizon that will remove the HIPAA requirement for healthcare providers to not identify the addicted medical condition of an adult SUD sufferer to their parents? This provision contributed to the death of my adult son from an overdose after 10 years. Thank you for your question, and I'm sorry for your loss. There has been a lot of discussion, and I might ask Jess to jump in on this one because I think Jess has worked on this in the past, but there have been different bills pending and proposals around this issue. I haven't seen anything moving on this piece currently, but there are working groups on this issue that are looking to be able to take it up. And we can certainly, Eric put his email in the chat, or perhaps it's out there. I don't know if folks can see the chat the way we can, but I can also share my email, and I can provide a little more information for you on what I had heard in the last Congress on this issue, and see and sort of give you an update separately. But that is a very important issue. I don't know, Jess, if you wanted to jump in on this one, because I think it's been several years now that folks have been looking at making changes in this space.
So there were a few changes made in HR6, the Support Act, to allow for sharing of information, particularly after a non-fatal overdose, and we can share the details of that section with you. We have had discussions with ENC and some of our Senate champions in the healthcare space about kind of running into some of these HIPAA restrictions and how we make sure that we bring family and caregivers into the fold to make sure that this is, treated like the crisis and emergency it is, bringing more people in to assist with services instead of sort of letting these privacy laws prevent us from getting people connected to care. So we've made some progress with a few adjustments in one of the other bills that we've worked on, but we'd love to have your feedback and take any of other ideas or challenges and barriers, and really sort of the consequences of some of these pieces that Congress may not know about. So please reach out to us and we will get you connected to the right committee.
Thank you, Jess. I knew you would know about that. I want to just check in with folks to see if people have been able to access those letters and links now that we have in the chat. If I don't hear anything else in our chat, I'm going to assume that they were. Eric, were you able to go ahead and release permissions on those? Yes. Okay, yep. Great. Got a thumbs up from Michelle, and Eric is saying yes. Wonderful. So any other technical issues with that, please let us know in the chat. We will do our best to get those. And then we're going to re-up them as well as Congressman Trone is speaking, and also as Senator Booker's staff is speaking, to just give us an update from their perspective about where the bills are and also their potential passage and progress toward that toward passage. So we are hoping that you are able to, and if you want to engage in that way, that we try to make it as easy as possible to do that in this virtual world. Any other questions I'm not seeing in the chat, but then again, I could be missing that, you would think.
I think we still have a problem with permissions on the Stop the Stigma Act letter. So if we could tinker with that. One little sort of just PSA here, and we could even put on some of Haley's very cool playlist music to give you all a few minutes. So, COVID and the realities are preventing us from being in person. You've met two of our all-stars, Lorraine and Michelle, who have been in more Hill meetings than they probably could count on all their fingers and toes 4 times over, which is really the magic behind us being able to have some accomplishments and really have driven some change with new resources, new bills, new legislation on the ground. And so since we can't be together, it's giving you little packets. There was one year we did a little advocacy 101 like this, and we had our packets, and it was like pouring down rain, and we were all like soaked to the bone by the time we were done. But we have some stories to share getting this. So we are experimenting today. We have 8 bills that we want signed into law. They have like different buckets. They cover from improvements in the nexus with criminal justice involvement and addiction, in the opioid space, the co-prescribing bill, along with the state opioid response bill, some family support services, which is really within crisis services and the things that us as family members need, a veterans bill, and then the bill to help address stigma by changing the names for a few of the federal agencies that still have outdated words in their titles. We have a couple more that we might add to this list to maybe round it out to a even 10 or maybe even 12. Really, we're digging in right now with E&C on some ideas to better address stimulant use disorder. Meth and cocaine use are up, and along with fatalities related to stimulants. So that's another category, but we need your help, right? And since we can't all fly in and be on Capitol Hill together, there's well over 100 of us on today on a Friday afternoon. When we have 100 individuals who are either practitioners, physicians, family members, individuals in recovery, when we all sign a letter, we get to put out a press release Monday morning. We get to deliver that to the members of Congress to say 119 impacted family members and those working in the field endorse the STOP Act, the Medicaid Reentry Act, the Equal Act, the Family Support Services Act. They urge Congress to act on this. This gets read into the record. This gets a blog post that put out there. And we've included two different pieces in this. One is if you have an organization and you have authority to add your organization, if you've started a local grassroots group, your own foundation, your own harm reduction or service program locally, you can add your organization, or you can just add your name as a private citizen and someone cares about this, or you can do both. And we'll have 2 press releases that can go out, right? You can circulate these and download them or ping them to your cell phone to text them to everyone that you work with locally. And when we get that up to 300 individuals and 150 organizations endorse this bill, that is, all politics are local. They care about you and individuals on the ground in their states and their districts caring about issues to elevate this. So make some mischief with us by generating some support and some buzz around these 8 bills to start with. We're going to make sure that Liliana, Eric, and I, we've chatted about this. Folks are now coming to us saying, hey, so what are your priorities this Congress? And that's a beautiful thing, right? We are trying to make sure that the challenges and the top needs and priorities of the patient and family community are front and center. And that progress that folks are asking where we stand on different issues or what our priorities to get past this Congress, that's really due to you all, due to our Michelles and our Lorraines that have made this happen. So we're going to start with these 8. I got another 1 or 2 that I think we need to do to make sure we're not ignoring stimulants. And then I think we keep making sure that we assess our priorities to make sure they meet your needs. These issues come from what we've heard from you, right? Us finding and identifying these 8 bills with these categories come from the feedback in all of our work with those in our network on the ground. So we're excited. If you can't, hopefully we fixed the 3rd form. Is that a thumbs up almost?
I think it's been, there's a note in the Q&A that I think it's been fixed. Should be working now. But again, ping us if it's not.
Yep, Jess, I just need you to share the permissions of the form with me and I'll get it updated.
Yeah, so this is totally on me.
Nope.
Which one isn't working?
It's the Stop the Stigma. Just make me an admin and I got it.
Is that on collaborators?
Yep.
Editors. I mean, you're an editor. Is that working?
There might
Perfect.
be.
Got it. Thank you.
Cool. See y'all. That was my bad. I didn't have enough coffee this morning when I was tinkering with forms, but we work through our technical difficulties. So if we can please share this, we're going to get a similar legislative alert and a form out on the other 5 bills to you next week. And then we'll have sort of you can always check for updates on our website. We send out a monthly advocacy alert. We'll give you updates on these and other funding decisions and where we stand. But there's some pieces that we need to see implemented and some new stuff we need on the board. So let's roll up our sleeves and help some of our champions get these bills done.
Jess, can I just add to encourage everyone, besides signing on to these letters, to contact their own their own representative and their own senator and just express your desire for them to support the bills as well.
Absolutely. We'll include some links to like sample co-sponsor. Ask your whole delegation to support the bill, be a co-sponsor. You can tweet at them. You have your click to tweet. You can use the same one over and over again. And then once you put your @ sign, you can find all your legislators and tag them. And then all of their comms directors are going to be like, wow, all of a sudden this bill's a big priority. I'm going to bring this to my boss's attention. So I think we can have multiple strategies to get people to pay attention.
And Jess, isn't it true that they actually count the number of responses that they get when they start coming in? And so that really raises attention. I mean, you know, one person can make a difference, and then you ask another person to do the same on social media, and it really accumulates.
Yeah, absolutely. You know, you could have the content of this, you could copy and paste it, add your own context and have your own op-ed in your local paper or even a community paper, put it up on your own blog site. It really just one person, like Lorraine said, one advocate shining a light on this can make all the difference. Members, they do track which issues are coming in, how well they respond. They want to have good customer service, and you are their customer. They represent you. So using these pieces, and we'll keep you updated and celebrate some wins together when we have more successes, and when we hit some barriers, we'll let you know that too, so you can all help us sort of figure out how to get these done, right? You have to be creative and nimble, and we'll let you know which states we're focusing on when we need to bring more champions or members into the fold. But this is I think the best start of 8 pieces of legislation that I think can have an impact.
Thank you, Jess and Lorraine and Michelle. Completely agree with everything. And I wanted to say that we have the folks who are on right now with us on a Friday afternoon. Thank you so much. But I'd love to be able to send all these links and letters and Google Forms to all of the registrants, because we had many, many more who might want to engage as well and add to that. I know that the comms directors do track every tweet, everything that their boss has mentioned in. So individual tweets, and you may think like, well, I don't really have that much of a following on Twitter, or I don't do a whole lot of social media, but even the fact that you're engaging is even more powerful, because there's nothing more powerful to a member of Congress than a constituent who's active and engaged. I think unless there are more questions or things that I am missing in the chat, which is possible, so bear with me, I'm double checking. I think that we can wrap this session. Eric, did you have anything else to add? If not, I think I'm turning it over to you in a minute. Again, thank you, everyone.